My name is Razvan Buciuc. I'm a board-certified physician in radiology, and I am currently the director of neuroradiology and neurointerventional radiology at Maimonides Medical Center. So I have a dual medical training. I have started my first specialty, which is neurological surgery, back in my native country, Romania, and I have finished the training at Wayne State in Detroit. This was followed by a 2-year fellowship in stereotactic and functional neurosurgery, after which I took upon the specialty of radiology. I finished training at Long Island Jewish Medical Center, and I completed that training with a fellowship in neuroradiology and neurointerventional radiology in New York City. I started my career in the medical school with a very targeted desire to become a neurosurgeon, and that's starting from the concept that patients with neurological disease are double hit. One is by the disease in itself, the other part being the fact that your brain is yourself, and whenever your brain gets damaged, something out of yourself gets taken away. As the time has evolved, I realized that neurointerventional radiology can deliver similar services as neurosurgery can, but in a much less invasive fashion. So therefore, the transition through radiology and neurointerventional radiology. There are two things I do focus on patients with either hemorrhagic or ischemic stroke. In other words, patients that either have aneurysms or arteriovenous malformations in their brain or spinal cord that can produce a hemorrhagic stroke, or patients that have atherosclerotic disease or plaques in their brain vessels that could lead further on to an ischemic stroke. I have, not only that I come from Romania, but I pretty much crossed the world through my life so far. My father has worked as a diplomat in Japan through my younger years, and I had the opportunity to visit the country and live there for a little while. And what I have learned that the things that keep us together are much more fundamental and deeper than the things that separate us from each other. And having that understanding and belief in the same time, I think I can, as I said, translate unique messages in various, not necessarily languages, but cultural makeups, because they reach to the same core. This is a patient-centric philosophy, and starts from the establishment of a deep trust, with my understanding that if any human being is willing to entrust their brain, therefore their own being to me and my team, on my part there is a continuous profound responsibility to deliver that trust.